We are diving into the world of plastic surgery. Who's got it? Who needs it? Who wants it? And our very own Aaliyah Jasmine is back from Vegas, and she's got stories. Good stories. This is MTV Live! Now, sitting beside you is a real-life plastic surgeon. Everyone, please welcome Dr. Adibfar.
Thank you.
How are you, sir? Okay, so, you are a plastic surgeon.
That's correct.
Most common procedure you see?
Most common procedure I see that I do.
Okay, that you do, first of all.
Well, it really depends on the age range of the patient. Depends on elderly women, perhaps facelift, eyelid lifts, and so forth. But in younger patients, perhaps liposuction, breast augmentation, nose job, rhinoplasty, and all of those ages all get non-invasive procedures such as Botox.
We actually got a phoner, Allison from Scarborough.
I had a question. Is there an age limit that you advise people? Like, if a 16-year-old came in and said they wanted double Ds or something, are you going to think of them the same way as if a 34-year-old came in and asked that same question because of their age? Or do you think that there should be an age limit for plastic surgery?
That's a great question. It comes up often on different shows. Obviously, there's an age, but it's a age of maturity in the personality. Commonly, I do not perform any breast augmentation, specifically speaking, on somebody that's in the teenage years. I have had a patient or two in the past couple of years that were 17 and a half, 18, that were extremely mature, perhaps more mature than a 30-year-old person. Good grades at school. Both parents, I had them present there, and they were completely comfortable with the daughter undergoing that procedure, and had a very steady boyfriend, and had a lot of friends. In other words, the person was just not a loner and looking for a procedure that's going to change her life.
Sure.
Even despite that, I sat down for a good hour, discussed all of those things with her and her parents, and we decided to go ahead and do the procedure, but once she becomes slightly older, in other words, closer to age 20. Part of it is because perhaps in my mind I do have a set age, maybe more from a medical legal point of view, an age set in my head.
Is there a legal age?
Well, I would think a legal age is 18.
But it's not illegal to get it at 16. If
No, however, it's common to do rhinoplasty, nose jobs at a slightly younger age.
Oh, really?
We have a question for you over there in Red Mike.
I was wondering if any of the surgeries you offer are covered by OHIP?
Well, I personally, I do purely cosmetic surgery that's not covered by OHIP, but and in general, cosmetic surgery is not covered under OHIP. However, procedures such as breast reduction that are causing pain, back pain, and so forth, those are commonly covered under OHIP. That's correct. Actually, a lot of the ladies in my practice are ladies post childbirth who have lost a lot of their volume, and that's why they're getting the implant and the lift. But not necessarily all the 20-year-old girls that are coming to get the breast augmentation. This is surgery. There's potential for complications, and you can't just get one breast implant and expect it to last you for the rest of your life. So there is potential for complications, and that's why the patient has got to be informed about all of those, that there is going to be potential problems that may need additional surgeries in the future, and they are not necessarily going to look like a person in a magazine.
Doctor, I want to ask you, the case in France where the woman had the face transplant, she had nose, chin, and lips, I believe, and then she started smoking again, and the doctor said you shouldn't do that. It's
not a good idea.
Do you think that after you have plastic surgery, you have a responsibility?
Oh, yes, it is a responsibility. In fact, I make them sign on the dotted line that if they do smoke and they do have some complications, they are the primary cause of it. Nicotine is essentially chokes the blood vessels, and there's no oxygen arriving to the wound area, and therefore it won't heal. And you can have important for a potential patient to do their research properly. And by research, I'm not just talking about looking at magazines and who's got the biggest advertisements. No, not at all. Go to the governing bodies, Royal College of Physicians and Surgeons of Ontario, the Plastic Surgery Associations of the United States and Canada, and look up the surgeon and see whether they're appropriately trained for that procedure.
You can be reached at dradibfar.com, and you can be reached at, the website is
cosmeticinnovations.ca.
That's right. Yep, Saturday mornings on Sun TV.
And there's a list of all your episodes on there.
Oh, yeah.
Thank you very much.
Thank you.
Thank you.